In this next set, we have a few more labs that, depending on the symptoms a person is having, I will have them request these from their doctor to rule out anything. In the thyroid panel, TSH, T3, T4, and antibodies. So these are things that I want to know about the thyroid, because the thyroid hormone is like the little hormone battery that tells the cells to turn on and do their job. When thyroid function is low, everything slows down and it feels like you are dragging ass. You may be constipated. You may be cold all the time. Your hair might be thinning. And the reason why I ask for antibodies is that there are some people who might be having an autoimmune attack on their thyroid gland, but their TSH may still be normal. Or TSH was off and they were given medications and they still don't feel right. So if the antibodies show up, then we can find the source of why the body is attacking the thyroid gland and stop it. Homocysteine can be high if you have certain genetic variations where you don't move through the B12 and folate cycle efficiently, so the cycle backs up. Homocysteine can be elevated in this case and in others, and can be a way to monitor brain health. It used to be a marker for heart health, but wasn't always a reliable predictor. But I do still find it helpful for making sure that your brain ages the best that it can. B12 is a key nutrient in our nerve cells, and when it's low, you can have neuropathy in your nerves. It also plays a role in how you feel energy-wise, and low B12 for an extended period of times can even have dementia-like symptoms. In the expanded cardiac panel, such as the Cleveland Heart Panel or the Boston Heart Panel, is one of the top extra labs I wish I could get on everyone. But this often proves challenging in the insurance model as it is pricier. So first up is oxidized LDL. So LDL has extra oxygen on it, which it doesn't like, and so then it doesn't function properly and causes problems and inflammation. The cholesterol particle size, we want big bouncy cholesterol particles, not small sticky ones. Adiponectin is a hormone secreted by fat cells that help signal glucose levels, fat metabolism, and insulin sensitivity. With PLA2 and MPO, these are actually excreted in the artery when there is activity going on that is not a part of the normal function. And all of these markers are very good markers for how your body is handling the types and quantities of fats that are coming in and in relation to carbohydrate types and amounts. We can see if there are signs of cardiovascular trouble, because food and lifestyle heavily influences these markers. So it's a way to use data and not drama about making food or lifestyle changes, as well as making much more specific recommendations for certain nutrients that can help improve function and reduce the risk for heart attacks or stroke.